Today our topic is Edwards syndrome. The trisomy 18 syndrome, also known as Edwards syndrome, common autosomal chromosomal disorder, presence of extra chromosome 18. Edwards syndrome. The syndrome pattern comprises of the major and the minor anomalies and increased risk of neonatal and the infant mortality, significant psychomotor and the cognitive disability. Prevalence at birth higher in the females compared to male. Epidemiology: trisomy 18 is the second most common autosomal trisomy syndrome after the trisomy 21. 1 in 6,000 births will have the Edwards syndrome. There will be three types: regular or the full, which is severe. This is when every cell in the body has the 3 copies of the chromosome 18. 94% of the cases. Type 2, mosaic, less severe, when some cells have the usual 2 copies and some have the 3 copies of the chromosome 18. The extent and the severity of the condition will depend on how many cells have the extra copy of the chromosome 18. The percentage is nearly 5. Partial, when there is the extra copy of only a part of the chromosome 18. The effects of this may be the milder one. Etiology: the extra chromosome is present because of the non-destruction. Methylene tetrahydrofolate reductase gene. Polymorphism in mother. Advancing maternal age. A small positive association of the paternal age. While speaking about the pathogenesis, these are caused by the genetic abnormality before the conception when egg and the sperm cells are made. A healthy egg or the sperm cell contains the 23 individual chromosomes, one to contribute to each of 23 pairs of chromosomes needed to form the healthy 46 chromosome cells. While speaking about the pathogenesis again, they are sometimes egg and the sperm cell, they are left with 24 chromosomes. Joining of these eggs or the sperm cell, a trisomy fetus to be formed. Here the clinical description is prenatal growth deficiency, specific craniofacial features, minor or the major malformation, marked psychomotor and the cognitive developmental delay. Clinical description like the growth delay starts in the prenatal period and continues after the birth, associated with the feeding problems that may require the internal nutrition. They have small mouth and jaw, small neck, wide nipples, short sternum, dysplastic ears, prominent of occiput, flexed big toe, prominent heels and the clenched hands. Sometimes the baby also have a smooth rocker bottom feet with a rounded base. Clenched fist with the overriding fingers, index finger overlapping the third and the fifth finger overlapping the fourth. Anomalies of the ears: skin at the back of the neck. Dolichocephaly: short palpebral features, micrograntia. Small fingernails, underdeveloped thumbs, short sternum, club feet. While speaking about the cardiovascular region, 80 to 100% ventricular and atrial septal defect patient, ductus arteriosus and the polyvalvular disease. Respiratory one: upper airway obstruction, in some cases due to the laryngomalacia or the tracheobronchomalacia and the central apnea. People may also have the ophthalmologic, ears and hearing. Musculoskeletal one: genitourinary neoplasia and the neurologic one. The central nervous system, they have the cerebral hypoplasia, agenesis of the corpus callosum, polymicrogyria, spina bifida, craniofacial orofacial cleft, eye macrotopia, coloboma, cataract, corneal opacities. Gastrointestinal abnormalities like omphalocele, esophageal atresia, tracheoesophageal fistula, pyloric stenosis. The diagnostic tests are: we can go for the physical examination, X-ray, echo and karyotyping. Antenatal diagnosis like the maternal serum analysis, human chronic gonadotrophin, unconjugated estriol and the alpha fetoprotein, they are significantly lower one, and the synthesis chronic filler sampling. Ultrasonography, the first trimester screening, neutral translucency, pregnancy associated plasma protein and the free beta HCG. In second trimester, they can go for the quadruple screening, serum alpha fetoprotein, total HCG, unconjugated estriol, and the inhibin E. Ultrasonography, growth retardation, polyhydramnios, strawberry shaped cranium, brachycephaly, and the narrow frontal cranium. Overlapping of the hand fingers, second and the fifth and the third and the fourth respectively. Congenital heart defect, omphalocele, single umbilical artery, prevalence of the growth retardation and the polyhydramnios increases with the gestational age. Trisomy 18 pregnancy have the high risk of the fetal loss and stillbirth. Survival after the birth and the neonatal management. There is a high percentage of the fetus dying during the labor and the preterm pregnancy. Approximately 50% of the babies with the trisomy 18 live longer than 1 week, and 5 to 10% of the children survive beyond the first year. Causes of death: central apnea, cardiac failure due to the cardiac malformation, respiratory insufficiency due to the hyperventilation aspiration, upper airway obstruction. Growth and feeding: prenatal growth retardation 1700 to 1800 gram, weight and the height greater than the third centile in the postnatal period, feeding difficulties, sucking in the swelling problems, gastroesophageal reflux, pneumonia and aspiration. Developmental and behavior: developmental delay is always present, marked to profound degrees of the psychomotor and the intellectual disability, slow gaining of some skills, expressive language and independently walk are not achieved. How it is treated? Treatment for the: there is no cure for the Edwards syndrome. 90 to 95% of all babies born with it die within the year of birth. The few infants that do survive need the special treatment ranging from the muscular therapy to the nervous system and the skeletal correction for the various handicaps. Management: nutritional support, treatment of infection, transfusion for the low blood cell counts, medication such as diuretics and naproxen to manage the heart failure. Health supervision and the management should be needed. Follow-up visit, anticipated guidance and the immunization should be given. Can trisomy 18 be passed to the future generation? Trisomy 18 is caused by the non-disjunction. It cannot be passed on to the future generation. Thank you.